Hello, my name is Dr. Heather Gornick. I'm the co-director of the Vascular Center at University Hospital's Harrington Heart and Vascular Institute in Cleveland, Ohio, and I am the proud chair of the 2024 ACC-AHA Guideline for the Management of Lower Extremity Peripheral Artery Disease, or PAD. And with me today, Dr. Herb Aronow, who's the medical director of the Heart and Vascular Service Line at Henry Ford Health in Detroit, Michigan. The document dives into very specific clinical scenarios and also revascularization. So Herb, take us through the approach to chronic symptomatic PAD.
I think I want to start by emphasizing how important this change in nomenclature is around patients who have chronic stable symptoms. Historically, I think we've often referred to them as having claudication, but as we know, many have atypical symptoms. And so this broader terminology, I think, reflects that. In those patients, after full trials of medical therapy, guideline-directed therapies, structured exercise, if they still have lifestyle-limiting symptoms, that's the point at which we then begin considering and discussing revascularization. And that discussion should involve weighing the risks versus the benefits of proceeding down that path. Revascularization is reasonable in this situation. And what revascularization options should be considered is going to depend a little bit on anatomy. And so we've spent some time on how to manage aortoiliac disease, acknowledging that endovascular revascularization is effective in that situation and that surgical revascularization is reasonable. We've looked at common femoral artery disease, which, as you know, can be at times controversial. And I think acknowledge that we still have a lot to learn about how to manage that from a revascularization standpoint. And we address that as well. And we've also touched on the fact that we don't really know when it comes to below the knee disease, whether revascularization in that setting is beneficial or harmful in patients with chronic symptomatic PAD. And so all of this can be gleaned from this updated version of the guidelines. I would just finish, I think, by emphasizing it's important no matter what path is taken in patients who undergo revascularization, that we don't forget about guideline-directed medical therapies, that those still remain a very important, a critical part of our overall treatment paradigm.
Yeah, absolutely, Herb. And one thing that just came to mind is we actually had a whole separate section on longitudinal care that emphasizes that even after revascularization, these patients need to be followed and treated with medical therapy for the long haul. So thank you for that summary.